certainly most MD clinicians learn from drug reps, or they learn from going to medical meetings if they even attend them without playing golf. And even if they are wanting to learn this stuff, and they do read medical literature, let's say they do study medical journals, but just about 75% of all studies published in medical journals are financed by the pharmaceutical companies. And they're not. Please understand that pharmaceutical companies do not do studies that they publish for the sole purpose of trying to understand some truth to make people healthy. They're publishing studies as part of their marketing effort to sell a drug. And the playing field, so to speak, is not level. They will publish the studies that will give them or give their drug a better image. And if there's a study that is negative to their drug, they will publish it. And they tend to model the experiment in such a way that there will be a positive outcome. And as I say, if there isn't by some chance, it'll never get published and nobody will ever hear about it.
My name is Gwen Olson, and I am the author of Confessions of an RX Drug Pusher. I'm a 15-year veteran of the pharmaceutical industry, and I left in the year 2000. And what I would like to do today is I would like to dispel the myth that the pharmaceutical industry is in the business of health and healing. Because in fact, what the pharmaceutical industry is in the business of doing is disease maintenance and symptoms management. They are not in the business to cure cancer, to cure Alzheimer's, to cure heart disease, because if they were, they would be in the business of putting themselves out of business, and that in fact doesn't make sense. I don't want people thinking that I am a conspiracy theorist, because in fact there is no theory behind what I'm telling you. It's all provable. And what I'm saying is provable is that the pharmaceutical industry doesn't want to cure people. And one of those things was the consistent minimization of side effects that drug reps were taught to do. And I was very concerned about the fact that it was seemingly less and less popular to give full disclosure about our drugs as time went on in my profession, and we were more responsible for marketing information being given to the doctors than actual good medical information, fair balanced medical information. And we were given the exact verbiage, the taglines that went along with the marketing department's plan for that particular sales period, and those were specifically the things that we were supposed to say. And often these things had been cleared through legal so that we weren't saying things that were illegal, but the semantics of them might have been implying things to be a little bit different information. And we were given the exact verbiage, the taglines that went along with the marketing department's plan for that particular sales period, and those were specifically the things that we were supposed to say. And often these things had been cleared through legal so that we weren't saying things that were illegal, but the semantics of them might have been implying things to be a little bit differently than they were. And I'll give you an example of that. One of the biggest things that I saw that took place was when we would get marketing promotional materials. For example, a sales piece would come out and have a bar chart or information from a clinical study on it that raised concern with the physicians. Say a number of physicians would start to complain about the excessive number of CNS side effects, for example. Then what we would see is the next marketing period, after reps had disclosed that during a district meeting or some kind of a pool meeting that we had, that marketing piece would come out and would be revised, and that bar chart would be changed, or that, specific information would be altered so that perhaps the CNS side effects were now broken out to dizziness and, the various other side effects that would be included in the central nervous system section. but that specifically was the way that we were supposed to approach the doctor. If you knew if he was an analytical, then you were supposed to approach him with a research study, because they were people that liked numbers and people that wanted, that type of information. And if they were an amiable, then you knew that that was the kind of person that you could basically just get to do anything that you wanted them to do, because they were just people pleasers and they wanted to make you happy. And so you could pretty much lean on those people as opinion leaders if you wanted them to promote drugs off-label for you with other practices or with other physicians. And then, of course, there were the drivers, which were the doctors who were in charge, and therefore you had to take the back seat, let them think that they were leading the conversation and that you weren't teaching them anything. You were, in fact, just talking to them. And that type of training was very intricate. I mean, we were taught specifically how to approach physicians so that we could get the maximum result out of our presentations. People and understand that the pharmaceutical industry makes 5 to 6 times the amount of money as any of the other Fortune 500 companies in the United States of America. They are not going to easily or readily give up that income. And we are, in fact, considered a human commodity. Our loved ones, our children, our elderly are considered cash cows that are preyed upon by pharmaceutical reps such as myself, who are encouraged to go in and build market shares without thinking about the consequences to patients, without knowing the misinformation that they are distributing, without being aware that the clinical data has been contrived, or that the patient populations have been cherry-picked, or that the side effects have been minimized and reported in such a manner that it doesn't present the information correctly. I spent 15 years in this industry. I was one of the best, but I'm here to tell you that the industry has run amok, that we are at a severe crossroads in this nation, and that we have got to take our power back, and we have got to start making the pharmaceutical industry accountable for their actions and for the defective products that they're putting on the market. It won't be long before every American is affected by this disaster, and we need to be aware of what the differences are between diseases, between disorders, and between syndromes. Because if it doesn't have to be scientifically proven, if there are no tests, if there are no blood tests, CAT scans, urine tests, MRIs, if there is nothing to document that you have a disease, then you in fact do not have a disease, you have a disorder. And it has been given and has been diagnosed pretentiously. And you need to get yourself educated and understand that there are options, and those options are much more effective than drugs. You need to look into the nutritional aspects of your diet and your lifestyle aspects. Are you exercising? Are you taking care of yourself in the ways that you need to be proactive about your health? Because once you start down the road of taking one prescription drug on top of the other, you will be a lifelong customer for the pharmaceutical industry, and your choices will be truncated. So I would like to ask you to please self-educate, be proactive, and share the information with others. The next victim could be someone that you love. Thank you.